Hi, I'm Riley.
Hi.
I'm going to be your nurse today. Today we're just going to do a quick head-to-toe assessment. Shouldn't take longer than 20 minutes. Is that okay?
Mm-hmm.
Perfect. Can you just state your legal name and birthday for me?
Madison 925 2000.
Do you have any, I'm going to double check on your wristband real quick. Perfect. Do you have any allergies to any medications?
Nope.
Okay, so if the patient did have any allergies, I would ask her what her reaction is. And coming in today, do you have any pain?
No.
So on a scale from 0 to 10, 0 being no pain at all and 10 being the worst pain, what would you rate it at?
0.
0? Okay, so if the patient did have pain, I would use old carts to assess her pain. Coming in, I observed her mobility in her gait, and she had a steady gait. She had no abnormalities to her walk. She has a straight body structure in the sitting position. Observing her right now, she looks to be clean. She has good hygiene. She's wearing the proper clothes for the weather, long sleeve shirt, long pants. Can you state your height and your weight for me?
5'7", 140.
Perfect. So based on the information that the patient gave me, she has a normal BMI and it's in the healthy range. So do you know why you're here today?
For assessment.
And where are we?
Loyola.
And what's the date?
It's Thursday.
It's Thursday. Okay, so based on those questions and the previous questions I've asked, I can say that the patient is alert and oriented ×4. Next, I'm just going to move on to the head-to-toe assessment. So I'm going to start out by your head, and observing, I can see that your head is a good size and it's round for your age. It sits properly and easily on your shoulders. I'm just going to take a look at your scalp, and while inspecting her scalp, I'm going to be looking for any abnormal macules, any dandruff, some bugs that might be in there, and I can see that she has a good hair distribution. She has smooth, silky hair. Next, I'm going to move on to her facial examination, so can you just look at me at my nose? So looking at her, she has a symmetrical face. Her top of her ears line up with her eyes. Her eyebrows are the width of her eyes, and can you smile? Perfect. So by having the patient smile, I can see that the patient's facial muscles are working and she has no drooping. Next, I'm going to move on to your ear exam. So looking at the patient's ear, I see that she has a piercing in her right and her left ear. I don't see that there's any drainage in either of the ears. And do you normally wear hearing aids?
No.
Perfect. Are you in an occupation or environment that might cause hearing loss?
No.
Okay, and have you experienced any hearing loss recently?
No.
Perfect. So if the patient did have hearing loss or experienced it or was in an occupation, I would dock that on her chart and I'd ask her further questions. Now I am going to move on to your eye exam. So I can inspect that the patient's eyes are round, they're white, and there's no redness. There doesn't seem to be inflammation or any mucus. And now I am going to assess it. So can you just look over my shoulder? Perfect. And then follow the pen out and back in. Perfect. So the patient's pupils are round, reactant. They're equal and they react to the light and accommodate. Next, I'm going to move on to her nose assessment. So can you tilt your head back? Perfect. So looking in her nose, I don't see any inflammation, and her septum is in the middle, so it's not spaying to one side or the other. There's no drainage, and then I'm going to do a quick range of motion for your head. So can you tilt it forward, and then back, and then to the left, and to the right. Okay, so my patient has a full range of motion for her head and neck. Next, I am going to move on to the mouth assessment. So can you open? While I'm looking at her mouth, I'm looking for any cracks in the teeth. I'm looking for any bleeding of the gums or inflammation. I don't see any abnormalities or anything like that. And then if I was in a clinic, I would use a tongue depressor, and I would press down her tongue to expose her uvula and her posterior pharynx. So I'm just going to take a quick look. Perfect. So her uvula is rising and falling normally, and her posterior pharynx is moist and inconsistent with the right color, which is like a pink-red color. Next, I am going to move on to a skin assessment. So while taking a look at her skin, I am just gonna see if normally she would be in a gown, but for privacy reasons, I'm just gonna inspect the skin that I can see. I don't see any visible tattoos. I don't see any abnormalities. There's a couple macules, which is not a problem. There's no rashes. Her skin temperature, let's see, is consistent throughout. She has good arm hair, which means that there's vascular and there's blood movement. I'm gonna test her skin turgor. Perfect, so that shows me that the patient is hydrated and she has good skin elasticity. Next, I am going to check her fingers. So her capillary refill is less than 2 seconds, which is what we want, and her nails are nice, rounding, and smooth texture. And then, can you put your nails like this for me? Perfect. So by able to see that diamond in there, that shows me that the patient has no clubbing. Now I'm going to take your radial pulse. So normally I would be taking this for a minute, but I'm not going to do that today for the video. Okay, so her radial pulse was bilaterally 2+ with normal sinus rhythm, which is what we want. Next, I am going to move on to like a strength test of your arms and upper extremities. So can you put your arms out wide for me? Down, and then can you hold them like this? And resist, and now push. Perfect, and now put them down, and then can you put your wrist in, your wrist out, and then wiggle your fingers, and then can you make a fist? Perfect. So this tells me that my patient has full range of motion of her shoulders, her elbows, her wrists, and her fingers, and then she also has a 5 out of 5 strength of her muscular system. Next, I am going to do the same thing with your legs. Okay, so can you flex your legs out, actually? Lift them up. Perfect. And now, can you resist me? Okay, push against me. Okay, and now with your ankles to your feet. Okay, push against me. And now, can you put your toes in like this? Toes out like that. Circles, other way. Okay, and now I'm gonna take her pedal pulse. So I'm gonna go right here, and normally I would do this for a minute as well, but for the video I'm not going to. Okay, so bilaterally she has a 2+ pulse and with a normal sinus rhythm, which is great, and she has a 5 out of 5 for her strength of her muscles, and she has full range of motion of her hips, her knees, and her ankles and her toes. Can you wiggle your toes? Perfect. Okay, so next I am going to do your respiratory assessment. I'm going to do 6 points posteriorly in the back, and then 6 points anteriorly, and then 2 laterally. I am going to start out with her bronchioles, and then her bronchiovesicular, and then her vesicular. And just by observing, I can see that our patient is easily breathing and is not using her accessory muscles. Before I use this on my patient, I'm going to clean it. So I'm going to start on her right side in her bronchial, and every time I place this down, can you take a deep breath in and a deep breath out? And now on to her left bronchial, and now her left bronchiovesicular, her right bronchiovesicular, and now down to her right vesicular, and now her left vesicular. Perfect. Now I'm going to do the same thing posteriorly. So this is her left bronchial, her right bronchial, and then her right bronchiovesicular, and then her left bronchiovesicular, her left vesicular, and then her right vesicular. And then I am going to do her lateral ones, right? One right here, and then the last one right here. Perfect. So through auscultation, I heard no adventitious sounds. Your airway seemed clear. There is no wheezing, which is all normal, and that is what we want. Next, I am going to do gastrointestinal exam. So normally my patient would be in a gown and I would expose the abdomen, but for privacy reasons, she's gonna stay in her shirt. And at first, I'm just gonna start out by asking you when your last bowel movement was.
This morning.
Perfect. And then when was your last menstrual cycle?
Right now.
Okay. So I'm gonna start out by auscultating. I'm gonna again clean this, make sure it's clean. And then I'm gonna start in the right lower quadrant and work my way up to the right upper quadrant. And then go to the left upper quadrant and the left lower quadrant. So I heard normal bowel sounds. It was not diminished or unheard. And next, is it okay if I palpate? So I'm gonna palpate my patient's abdomen. I'm gonna feel for any tenderness, and I'm also gonna look for any grimaces on your face. And if you're feeling any type of pain, please tell me. I'm gonna start in the right lower quadrant again. And I'm palpating all over the quadrant. And then the right upper quadrant, and then the left upper quadrant, and now the left lower quadrant. Perfect. So last is the cardiovascular assessment. So I'm gonna listen to your heart and assess your heart. First, I'm gonna start out by taking your carotid pulse, and I'm gonna do each one separately. Normally I would take it for a minute, but for the video I'm not. Okay. Okay, so her carotid pulse was bilaterally 2+ with normal sinus rhythm, which is again what we want, normal, nothing abnormal. I'm gonna start out by auscultating your heart. You do this in the ape to man, and it starts out by at your angle of Louis, and then from the angle of Louis, you go over to the right side of the sternum and to the second intercostal, which is your aortic valve, and then you go to the left side of the sternum, second intercostal, which is your pulmonic valve, and then you go down to the third intercostal on the left side, which is your Erb's point, and then the fourth intercostal on the left side, which is your tricuspid valve. And then you go to the left side, midline up their clavicle, all the way down to the fifth intercostal space, and that is their aortic valve, their mitral valve, and it's the point of maximum. And it's also where I'm going to take their apical pulse. So I'm going to start out by doing that. I'm going to make sure my stethoscope is clean. So the angle of Louis, and then over to the right side, second intercostal space, the aortic valve, and then I'm going to listen on the left side, second intercostal space, pulmonic valve, and then down to the third intercostal space, and then down to the fourth intercostal space, the tricuspid valve. This was Erb's point, and then I am going to go over to the midline, all the way down the mitral valve, and then I'm also going to take her apical pulse for a minute. I'm not actually going to do it for a minute though. Perfect. So her apical pulse was within a normal range, which is it's probably around 80 beats per minute. And during the listening to her heart, there's no signs of murmurs or whooshing sound, which is normal. I didn't hear anything abnormal. And that is all for the head to toe assessment. If I was in a bed, I would have the side rail that I am next to. I would have it down while I'm assessing the patient. And as I finish up the assessment, I am going to put up both of the side rails. I'm going to hand the patient the call light. I'm going to lower the bed all the way and lock it. And is there anything else that I can get you? Nope. Anything for comfort?
Nope.
Okay, perfect. And again, if you need me, your call light. And then I am going to do hand hygiene, and the doctor should be in.
Thank you.
Thanks.